Great question, and I've answered this before, but we're going to talk about it again. And then, what is a dog ear? So dog ear is this, I don't know where it came from, but basically it's it's skin redundancy at the end of an incision line. And so it is most commonly associated to a tummy tuck surgery. And in my hands, I am anti-dog ear. And we'll talk about it why. So if you Google search something, this is what a dog ear would kind of look like. So this is her from the front, this is her butt, and at the end of her incision line, this is not mine, is you get this little skin pucker. It can be a spectrum. It can be a skin pucker. It can be even more where you have this bulge. I see this more commonly, and this is like this bulging area. So I guess it kind of looks like a dog ear, but this is the reason this happens is because that incision isn't long enough. The incision for her needs to go a little bit further back, take a little bit more skin, and so surgically what I would do is I actually remove this skin a little bit more, go a little bit further back, take a little bit further back, and then also contour with some liposuction even more in this whole area, okay? And what that would do is that bring it down and restore the contour of the hip and waistline. So that's typically you're gonna find these. You're gonna find these along the hip and waistline area, and it has everything to do with incision length. And if you say, Dr. Morales, I don't want to scar that long, I'm gonna tell you, I'm sorry. I don't want to do a dog ear, and you're gonna hate them. Everyone hates them. Nobody likes them. You will absolutely get upset with me. You have one. Again, the spectrum. You don't want, this little skin fold, sometimes that's super easy. We can do that in the office. Sometimes the sutures don't heal right and doesn't lay down flat. Not a big deal, but this is more of a problematic issue. It also becomes more potentiated and more exaggerated if you have a dramatic waist to hip ratio. You have a really contoured waist and have much more of a hip and buttock area. This can be a little more pronounced. Where you put this incision is also important. If you put it out here on the kind of more on the outer thigh, upper buttock area, it's going to bulge more. And if you kind of tilt it up a little bit more along the natural curve of the pelvis, it happens less. So I've learned that the idea is you want to kind of follow the natural pelvic curve when I do a tummy tuck to an extended to a body lift. It needs to kind of curve up and around. So again, this comes down to surgical technique. There's an art to this. This is something that is not uncommon when you have just a tummy tuck alone and you didn't do any liposuction contouring, because I do think the liposuction actually improves the aesthetic and makes sure we can reduce the incidence of a dog ear formation. So if you have one, it's fixable. You need to go see your surgeon, and don't be scared or put off if they say you just need a longer scar to correct that with maybe some liposuction. So hope you learned something. Don't forget, like and subscribe. I'd love to bring your more questions in and answer them for you, and stay tuned for more.